Normally we'll run through the whole comprehensive examination process. We'll have a look at your teeth. Of course, we have to make sure that you're free from any dental decay and any gum disease to begin with. So once we give you the kind of clean bill of health, that's when we'll start to talk about whitening with you. We really have to make sure everything is kind of like all good and well before we sort of start to look at that. I would sort of classify it a bit of both, because of course, whitening is good. I mean, it's an aesthetic procedure, it makes you look good and stuff, but I mean, in terms of wellness as well, it gives you, I guess, a more confident smile. That in turn, it will also lead to, a more pleasant look. I think it will sort of I guess it will help as well with, I guess, your day-to-day work and things like that, because especially if you're dealing with a lot of customers. So with the whitening as well, I guess it will give you a more confident smile. So with teeth whitening as well, of course, if you sort of do it at home, there are sort of home remedies that people are sort of thought of and to do. But of course, I would say the results won't be as efficient, because the whole process obviously is more of a oxidation process. So you actually need quite strong agents to sort of do that. And if you were to do that at home, it's not a controlled environment. You'll probably do more harm than good, especially to your gums and things like that. Rather than, if you come into us and do it professionally, we obviously will take all the necessary precautions to make sure things go well and it's all done in a professional way. Basically, when we clean everything out and we isolate everything properly, because with the agents that we use for whitening, if you get it onto the gums, it will actually cause a chemical irritation. Your gums will actually turn white, and obviously the worst case scenario is gums can even recede if the concentration is too high and it's left there for too long. So normally when we do professional whitening, we will actually put a gum barrier to actually protect your gums away, and then apply the agent onto your teeth, which of course that's what it's meant for, to whiten your teeth, and we'll get everything out of the way so things are done properly as well. So what we'll do is basically we'll sit you down, we'll put a set of retractors onto your teeth. We'll clean and polish everything up, get rid of all the plaque and any of the debris that you're on, sometimes from lunch, things like that. Get rid of that for you, and then we'll apply the gum protector, or it's like a gel that goes over your gums. That would actually help, like I said earlier, push the gums, get the gums out of the way before we apply the agent onto your teeth. And then before we put the light on, and that will help with the whitening process. The basis of the whitening gel is actually hydrogen peroxide or even carbamide peroxide. So it will actually penetrate through your teeth, release oxygen-free radicals, and that in turn will actually attack the stains that's on the tooth itself, and break that down and get rid of that. And then because some patients I know are a bit worried about this chemical process, is it harmful to me or things like that. But with carbamide or hydrogen peroxide, what happens is that actually breaks down to just water and oxygen. So the oxygen-free radical is the one that of course will attack the stains, but the other part is water. We just wash it away. In a layman term, how I explain to my patients is this. If I get a pot of black paint, how much white paint I will need to actually whiten that? So you need a lot of white paint to whiten a black can of paint. Whereas if you are kind of in a brown or even yellowish teeth, you'll probably need less whitening to actually get that. Put it this way, I wouldn't say it's impossible to do it, it's just it's a process that's just a lot tougher. I wouldn't say impossible. What's even harder than that is actually when you have a lot of intrinsic stains. That's actually internal instead of external. Of course, oral health and general health has some form of correlation. So just to elaborate on that, of course, diabetes, high blood pressure and high cholesterol is something that's quite common in our community. With that, if you are diabetic or even high blood pressure, you probably would have more oral health issues or oral manifestations from that, because they are kind of correlated. So just to give you an example, a poorly controlled diabetic has a higher risk of gum problems, what we call periodontal disease, because when you have poor sugar levels or poor control of your sugar levels, that in turn actually activates inflammatory processes that will actually contribute to breaking down of your gums and bone, which obviously leads to gum disease. So that's just one example of that. Another I think research has been done to show that if you have gum disease, the bacteria that's all in the mouth can actually travel through your bloodstream into, let's say the heart, because the circulation of your whole body, it's one system. So with the bacteria getting there, you're probably at a higher risk for heart disease or any form of heart issues because of that.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.